Good morning. Thank you for joining us for another Ministry of Health virtual media conference on the COVID-19 response. Our panelists today are the Honorable Terence Dayal-Singh, Minister of Health, Dr. Roshan Parashram, Chief Medical Officer, and Dr. Avery Hines, Technical Director of the Epidemiology Division of the Ministry. I'm Candice Alcantara, Manager Corporate Communication for the Ministry, your moderator this morning. We begin with the clinical update and a presentation from Dr. Roshan Parashram.
Hi, good morning. Thank you, Ms. Alcantara. Good morning to the Honorable Minister. Good morning to Dr. Hines. Good morning to members of the media and members of the viewing and listening public. So if I could have the dashboard as of the 18th of February 2022, which is yesterday's dashboard, we begin by, as per usual, giving the clinical update. So the new positive cases, 624 reported in the last 24 hours. Total deaths in the last 24 hours reported 4, and condolences to the family of all of those individuals who would have lost loved ones. Total patients in hospital, that is stepped down together with hospital, 357. Those active cases now stand at 20,731. And then if you're looking at the pie chart, the blue and green sections, we're seeing the patients by vaccination status from 22nd of July 2021 to 2nd of February 2022. Fully vaccinated 2,543, and not fully vaccinated 12,860, 83.5%, not fully vaccinated. Total deaths by vaccination status 230 versus 2,924 are those who would have been fully vaccinated versus not fully vaccinated. Just to go into a little more detail with the hospital figures. So in terms of positive patients in hospital at this time, 288 persons in hospital, and that is taking away the step down at this point. So 76 at the Couva Hospital and Multi-Training Facility, 8 in ICU, 5 in the High Dependency Unit, at the Cora Hospital 29, Augustus Long 50, St. Anne's Hospital 19, Harima General Hospital 52, New Point Fortin Hospital 19, St. James Medical Complex 33, and Scarborough Regional Hospital at Fort King George 10. The major ones in terms of step down, we have 69 persons, UWI Debe 20 persons, Point Fortin Area Hospital 26, and 12 persons at the Field Hospital in Port of Spain. So thank you, Ms. Alcantara. That's my brief clinical update for this morning.
Thank you very much, CMO. And now we go to Dr. Hines for the epidemiological update.
Thank you, Ms. Alcantara. Good morning to the Honorable Minister. Good morning to the CMO. Good morning to members of the media, members of the viewing and listening public. If we go straight to the epidemiologic slide number 2, that would be the epidemic curve. We do see that we have that ongoing trend of slightly fewer cases in that right-hand end of the graph in the dark blue bars, those cases representing numbers of positives by date of swabbing. And we're seeing that we are seeing a small decline in those numbers as we move from January into February. And the rolling average indicates that there is that downward trend as well. If we move to the second slide, we look at the same data now aggregated at a weekly time scale. And that shows a similar pattern, where the last bar is actually data up to Friday, so it's not a complete week, but it does indicate that the completed week 7 data will be significantly less than what we saw in week 6. We also see that downward trend with respect to the background salmon section, which is the positivity percentage. And this is again another encouraging sign in terms of what's presenting to the health facilities in terms of the percentage of those that then test positive for COVID-19. Moving to the next slide, same data now aggregated just in a tabular format, and we're looking at, in contrast to the change between week 5 and 6, where there was a 30% increase, we expect to see a significant decrease when the data for today is added and tallied. Moving swiftly to the next slide, we do look at the monthly aggregate data as well, and that shows the same pattern, where we have approximately 10 days left in the month of February, and we're at 11,168 cases for the month, so we are likely to end with a lower total than January, and that downward trend in the salmon section indicating a downward trend in the percentage positivity among those that are presenting with symptoms and being tested. Moving on. Next slide is the demographic slide, and that remains very much the same. And that is majority of cases being in that 25 to 49 age group, and an equal balance more or less between males and females. Whereas in the next slide, with the age distribution for the fatalities, we note that there is a predominance of those above 60. About 2/3 of that group is above 60, but 1/3 is below, and we do need to continue to emphasize that age is not the only factor. The other factors that are very important are whether or not you have comorbidities and your vaccination status. And we want to close on that note with the epidemiologic update. Please continue to get your vaccinations to reduce your risk of serious illness and fatality. With that, I turn you over to Ms. Alcantara.
Thank you very much, Dr. Hines. And the final presentation this morning will come from the Honorable Terence Dayal Singh, Minister of Health.
Thank you very much, Candice. Good morning to the Chief Medical Officer, Dr. Parashram, Dr. Hines, ladies and gentlemen of the media, good morning, and all good citizens wherever you are listening. So you'll notice we are going to be very brief this morning because I'm sure there are many questions that you would like to pose on the report from Professor Simangal. So we are being very brief this morning with our reports. The vaccination status as of last night, we have reached approximately 50% fully vaxxed in the population, 700,091. It's a good milestone. My only regret is that we could have done this sooner, but we accept it and we welcome this little milestone. The number of persons who have accessed their booster shots, 128,395. As we monitor the numbers, and you would have heard the numbers in the hospital system, you roll in 7-day average and so on, which are heading in the right direction, we have always been careful as to how we adjust the public health measures in response to these developments. I have been authorized by the Honorable Prime Minister and the Cabinet to announce the following adjustments to the public health measures that will come into effect from Monday, the 21st of February. So from next week, Monday, these adjustments will come into effect. As far as beaches and rivers are concerned, we are lifting the time limits. Right now, it's until 6 p.m., so there will be no time limit for beaches and rivers. However, all other caveats apply. That is, once you are not in the water, please wear your masks, no alcohol, no partying, no open fires, etc. The only thing that is being lifted is the time limits for beaches and rivers. All other measures in the public health regulations will apply. So you don't have to pack up and leave the beach by 5 o'clock. You can, take advantage of the evening sunset and whatever. As far as safe zones are concerned, currently safe zones cannot be frequented by children under the age of 12 because they are not vaccinated. So a child who would like to go with their family, their vaccinated family, into a safe zone like a restaurant, a cinema, and so on, from Monday, they will be able to accompany their vaccinated parents, their vaccinated siblings into a safe zone. So from Monday, the unvaccinated population, 12 and under, who cannot be vaccinated, can access these safe zone activities. All other safe zone measures will apply. That is, the employees must be vaccinated. All other accompanying family members must be vaccinated. A little word of advice and caution to both parents and owners of these safe zones as we welcome our under 12 unvaxxed populations into these business places. We are asking parents of these 12 and under to do your own risk assessment of your children who are unvaccinated, the 12 and under, and ask yourself if you have a child who is diabetic, who has an NCD, who is asthmatic, who is obese, overweight, please, in your own judgment, determine whether the risk you are taking is worth it. Yes, we are lifting the restriction, but we ask parents to do their own, parents and guardians, to do their own risk assessment of whether taking your unvaccinated 12-year-old and under into a safe zone is worth it. And we also ask owners of establishments that will now be allowing these children 12 and under to make sure and maybe step up your screening at the door, make sure no one with fever comes in, flu-like symptoms, especially your staff, so that we could continue to protect these children 12 and under. So those are the two major adjustments to the public health measures that I have been authorized by the Honorable Prime Minister to announce today that will take effect from Monday, the 21st of February. So Candice, that's my little update for this morning, and now we could take questions.
Thank you very much, Minister, for that update and, of course, that important precautionary advice. We go now to the question and answer segment, as Minister mentioned. Members of the media, I think we know the routine. Please indicate your name and the name of the media house that you represent before posing no more than 2 questions. Please be brief so that we can field as many questions as possible, and please pose both questions at the same time. We begin with questions from TV6 this morning. Let's go to TV6, please.
Hi, good morning to the entire panel. Alyssa Boucher from TV6 here. My first question, I believe, is for the Minister. Minister, yesterday the COVID committee, yesterday from the report of the COVID committee, they would have recommended that the policy on the drug tocilizumab be reviewed and that more of that drug be used to treat COVID-19 patients. And I was wondering, what is the current policy on that particular drug? So can you tell us what the policy is, as well as what is the ministry's plan in relation to that recommendation that was made? That's my first question. The second question is, have we done an assessment? Now, I know that the committee stated that staff shortage, especially in the hospital system, that's a worldwide problem, but do we know exactly how
Ms. Boucher, I think we lost a part of your question there. If you could just go straight to the question 2 for us. Just straight to the question itself.
Sure, no problem. So I know that the committee stated that staff shortage is a problem across, the globe as we battle this pandemic. But I was wondering, have we done an assessment to find out, by how short are we in the RHAs and the parallel healthcare system? What is that staff shortage looking like in terms of percentage and so on? And is there anything further we can do to address that?
Thank you. Great. Thank you.
Thank you, Alicia. So the CMO will go into details about the drug tocilizumab and what the criteria is according to WHO, and he will give you a chapter on verse on that. On the issue of staff shortages, so when the pandemic started, we employed and we ramped up. So let me go back in time. First of all, I want to thank the Honorable Prime Minister for instigating this report. It was a very brave decision to have a report done in the middle and at the peak of a pandemic. If you had done it now, the picture might have been different. But that's a good thing, and I'll explain to you why. It is only when a system is under severe stress that all the factors come out to play. And the report, in my view and our view, is a very balanced report. Very, very balanced report. The good and the not so good. But with this report now, what we have to focus on is the shortcomings. We accept the good, but the focus has to be on the shortcomings. On the issue of staffing, we employed a total of 1,776 persons across the parallel healthcare system. So we did that. We employed nurses, doctors, and so on. And the report did say that globally there were staff shortages. But the report also went on to say, if you look at it carefully, when it gave the nurse-to-patient ratios, and I'm looking for the page now, it went on to say, in a pandemic, there are no established protocols for staff-to-patient ratio. And that has been seen across the board, So we always said, Alicia, during the pandemic, there are no more persons to hire. We hired 1,500 or 1,700. You would have heard from the Honorable Prime Minister, Dr. Trotman, and especially Dr. Richards, who kept saying, a bed is not a bed. You need all those persons around it. And in my view, the RHAs and we did a reasonable job in handling a global pandemic for which there is no blueprint, for which the world had no previous experience except 1918. So in a pandemic, as the report said, there is no known ratio of patient to health worker, and we continue to monitor it, and we continue to find ways to deal with this. One of the ways we dealt with it at the ICU level was to put in electronic monitoring of the ICU patients so that you can't have one-to-one in a pandemic, but you did have persons looking at the patients on electronic screens, and as the alarms would go off, you would have persons rushing to people in ICU. Another part of the report, which we have to accept, is the truth, is the issue of staff burnout, which we have made no secret of. But staff accommodation, the report did mention there were some things that we could have, that the RHAs could have done better with staff accommodation. The report did mention that one RHA did a very good job in engaging staff, but maybe a not so good job in another RHA. And our staff is a key stakeholder, and I'll tell you something, I take those findings very, very seriously. And we will learn from which RHA did well, and we will help the other RHAs, which the committee found there were shortcomings in the way they engage staff to make sure we don't repeat that. But this report is going to find its way into international literature, and Trinidad and Tobago is going to be viewed as a leader in being open and transparent, showing the whole spectrum of the COVID-19 response. I will now hand you over to the CMO to talk to the issue of the tocilizumab.
Okay, thank you, Minister. So before I go into that particular issue, I just want to echo the sentiments of the Honorable Minister. And really from the point of view of the Ministry of Health, we really welcome the report, especially at a time during the pandemic when it would have been difficult for even the staff of the ministry to conduct this type of review. And it required experts in various fields to do so. And we're really looking at the recommendations as set out in 7.0 of that particular report. And why we focus on the recommendations is that the Ministry of Health would not have been privy to the minutiae and the data that led up to the recommendations being made. And if you notice within the report, that information is blinded. And the reason it is blinded is twofold. One, to maintain the independence of the committee in their decision making, and two, to maintain the confidentiality of the patients, as well as the staff that would have contributed to the formation of this report by giving testimonials and the like. So if you look at the 7.0, which is the recommendations, tocilizumab is mentioned at recommendation number 13 of 16. And just to read it out so the population has an idea of what Ms. Boucher was speaking about. So this drug is given at an advanced stage of COVID-19, and this is the words of the committee. Most staff were very impressed by its effect, and perhaps C40 needs to be increase the purchasing of this drug. Though it is an expensive drug, there's a cost benefit to be realized from its use, and we recommend that the policy regarding it be used and reviewed. So let me go into a little detail as to what the policy is. So generally speaking, there's a document entitled The Therapeutics and COVID-19 Living Guideline, World Health Organization, January 14, 2022, which speaks to the WHO recommendation for the use of this category of drug. It was available in Trinidad prior to the COVID-19 pandemic. It's an IV preparation on the national formulary, and it was used for rheumatoid arthritis prior to being used for COVID-19. So we did have a stock prior to it being approved by WHO. And what it is a IL-6 interleukin-6 receptor blocker, and is administered either through the intravenous route or the subcutaneous route. And it is really recommended for patients who are critically or severely ill. In our context, it generally means people in the ICU type of setting. And what we have done at the ministry is we have used the WHO guidelines and sent that forward to the RHAs once we realized, or prior to realizing, that WHO had gone ahead and given the green light. Through the clinical committee, the coordinating committee at the RHA level, they would have tailored that to the different RHAs, looking at the global supply, looking at the supply before them, to determine who had the best utility in terms of benefit versus risk of using this drug, which type of patient. Now, the Ministry of Health didn't go down to that level of detail to tell the clinicians or handpick any patients as to which one to use it. So just to give you some idea of what the report from WHO, which I previously mentioned, said as well. So, including prioritization of patients, highest baseline risk of mortality, example, those with critical disease over those with severe disease. So meaning generally prioritizing those in ICU possibly over HDU, in whom the absolute benefit of treatment is the greatest. For example, and when you look at the critically ill, it would have prevented 31 fewer deaths per 1,000, and that's a 95% confidence interval of 11 to 47 fewer deaths. And when you drop that to a severely ill population, the benefit goes down to 13 deaths per 1,000. So as the degree of severity of illness decreases, the utility of the drug also decreases. So the patients there are clinical guidelines in place and protocols both at the national level as well as the RHA level, led by the clinicians, which is adopted as new data comes to light regarding the use of the medication. It is an inexpensive drug. It costs us about 8,000 TT to treat every single patient that it is administered to. So that has to be borne in mind in terms of purchasing as well. But generally speaking, the guidelines exist, and of course we are happy to continuously review any guideline that is in place based on the data that comes forth.
Thank you. I just want to go back to Alicia's question to me. I have found the reference. So Alicia, if you look at page 85 of the report on the top, it says, and I mean, it's the reality in treating with a once-in-a-100-year pandemic. There are no guidelines about nursing ratios in a pandemic, and that's the honest-to-goodness truth. You are flying this plane and building it at the same time. So the report was clear. There are no guidelines about nursing ratios in a pandemic. When you're in a pandemic and you're in a war, you do what you have to do to save as many lives as possible. Things will never be ideal in a pandemic. But I think at the end of the day, the report was very balanced, and we welcome all the suggestions.
Thank you very much, Minister and the CMO. Let's go now to AZP News, please, for their questions this morning.
Hi, good morning. Suan Wayo from acpnews.com. Again on the report. Based on the 16 recommendations made, will or can the ministry be working towards any almost immediately? And if so, which ones will be given priority at the moment? And my second question is, based on the recommendations made, the entire report, what do you think, and this question is probably to the minister, what do you think this reflects on our current healthcare system? Thank you.
Thank you. So let me take the second question first. putting my biases aside, I think the objective people, and many objective people around the world, have already read the report. I am giving you what their views are, and I want us to remember this is a report that was done in the middle of our surge in a 1 in 100-year pandemic. The independent professionals, both locally and regionally and internationally, who have access to this report from yesterday at around 2 p.m. all through the night, because once it was made a public document, I did send it out. Their conclusions are that we have done very well for a small country with limited resources, as opposed to many other countries who currently are still treating patients in car parks. We were never at that stage. So context is important. Of the recommendations, we agree about things like data management. We agree with dedication of frontline staff. And as I said, one of the immediate things that I have to do, and we will be doing, is engaging the RHAs that did well to see what they did well and roll out that, because the pandemic isn't over. We agree with the communications with the patients. We did as best as we could. They say of the patients who participated in the survey, 60% were satisfied. But in a pandemic, we can do better, because our patients is the center of the universe. So I think communications is something that we have to improve on. One of the issues that we looked at was the issue of meals. That was issue number 8 of the recommendations. We have to look at that. So those are some of the recommendations we'll have to look at. I think moving forward, data management is going to be critical, and I'm glad that the committee raised it, because as you know, we now have a Ministry of Digital Transformation, and we are the Ministry of Health over the past year, which was slowed down due to COVID, and I'm looking for the document. We have a national policy now on how we digitize the entire healthcare system. So, Suan, one of the priorities now, as we are coming off this wave, is to actually operationalize the digitization of all aspects of the delivery of healthcare, which will redound to the benefit of both patients and frontline staff, and start to move away from paper and pen. That is a process that was slowed down because of the pandemic, but it's something that we are paying attention to now, as we can devote some time and effort to that. So thank you very much for the question, Swan.
Thank you, Minister. Let's go to TTT at this point for questions, please.
Hi, good morning. Sonal Lala from TTT News. How is everybody doing today? First question from me. Mr. Dayal Singh, based on the reports, has Cabinet deliberated on this yet? And what are some of the things were discussed, if it was deliberated on, and what does the Prime Minister have to say about it? And secondly, I know you would have announced some of the time restrictions being lifted. What would have prompted this? Is it because due to the decrease in cases we've had recently?
Thanks. So I will never discuss in the public what Cabinet discusses or not discusses. That is grounds for being fired, and I love my job. But the Prime Minister did get sight of the report. The report was delivered to me at around 1 p.m. on Tuesday, and I delivered it. I got 2 hard copies, and I delivered it to him ASAP by 2:30. It was at the Prime Minister's office. And he would have read the report, otherwise he would not have laid it in Parliament with a statement read out by the Minister in the office of the Prime Minister. And the statement coming out was a very balanced statement by Minister Young, highlighting that we adhere to international best practice on key areas, admission, discharges, and so on. So the Prime Minister is very aware of the report. Yes, what prompted the relaxation of time? Yeah, as I said, we continually look at the numbers and make decisions based on that. I think what will help with especially the allowing of children under 12 who are not vaccinated to get back into a social life and go to places that they were previously not allowed to get into, it will help tremendously with their mental health and the mental health of their families. They can now go out as a family. And Sunil, as the report said, the report focused on the mental health of the healthcare workers, but the mental health of populations around the world is important. And what you find around the world is that when people's mental health is better, they are more likely to be vaccinated because they see a reason. So this allowing of the children under 12 unvaccinated, with the caveats I have given, will help tremendously with the social interaction and the mental health of those children and their families. Thank you very much, Sunil.
Thank you, Minister. TV6, I believe that we have a follow-up question from you. So let's go to TV6, please.
Okay, thank you so much. I guess maybe the Minister or Dr. Parasram might want to take this one. Minister, I know that the government has taken quite a few initiatives to reduce the number of NCDs within the population in terms of making adjustments to what is to the school feeding program, as well as several education campaigns. But the committee did recommend that clinicians whose contracts are coming to an end be redeployed back into the system to help manage the NCD problem. Against the backdrop that NCD is a lifestyle problem, do you think that is feasible? What is the ministry's position on that? Thank you.
Okay. Alicia, I want to thank you very much for that question. Okay. So at the level of the Ministry of Health and the Minister of Health, the primary responsibility of a minister is policy. So on becoming Minister of Health, you may recall the most vexing problem in Trinidad and Tobago for decades, regardless of who was in office, was the issue of maternal mortality and infant mortality. What did we do as a government? You set policy, and the policy initiative was to appoint a Directorate of Women's and Child's Health. Based on that policy and getting the right individual into that position, and then build out a structure below him, we have brought down maternal mortality and infant mortality within 1 year of coming into office, and that has been maintained. The second major policy interaction, and Dr. Hazel Othello was before a Joint Select Committee about 2 weeks ago on mental health, was decentralization of mental health. Policy position, which I took to Cabinet to, like the maternal mortality issue, was you needed to have the czar, C-Z-A-R, this czar, this person sitting at the top of the mental health pyramid to drive policy. Cabinet approved the position of a National Director of Mental Health. That has allowed us to decentralize mental health, and today St. Anne's Hospital has gone down from 1,000 patients to about 700 patients. Patients are now being treated locally. So that is policy. On the issue of NCDs, I took a note to Cabinet last year, and I have it here. The employment on contract of a director, non-communicable diseases, in the non-communicable diseases unit of the Ministry of Health for a period of 3 years in the first instance. So that is what I have done at the level of the ministry. So this person, and the recruitment suffered last year because of COVID. You couldn't do interviews, and we were all caught up in the COVID response. However, interviews were held at the end of last year, I believe, CMO? Yes. Yes. And I think an appointment is to be made soon. So, at the ministry level, it's not about putting 1,000 boots on the ground as yet. It's a matter of getting somebody at the top of the NCD pyramid at the ministry, as we did for maternal health and child health, as we did for mental health, and now this is the third part of the major problem facing Trinidad and Tobago NCDs. Once that person is installed and we flesh out the unit, and that person, by cabinet decision, is automatically the chairperson of the National Food Advisory Committee. And that is how, at the ministry level, we are going to once and for all tackle this issue of NCDs in the country. So the policy is there, the posts were advertised, interviews were held. I think somebody should be installed within the next month, and then we flesh it out. We will have a national NCD policy, and as I said, that person becomes the chairman or the chairperson of the National Food Advisory Committee. In the same way, I think the CMO is the chairman of the National Drug Advisory Committee. Yeah, so that is how I, as minister, tackle these issues. So before we put 1,000 boots on the ground, before we put 1,000 infantrymen on the ground, we must have a general directing policy, directing action, and directing resources. So I am glad you raised the issue so you know what we are doing. Thank you very much.
Thank you for that response, Minister. AZP News, we're ready for another question from you, please.
Hi. Back to the reports. Should something like this be done periodically with or without a pandemic so that necessary adjustments can be made in a timely manner to perhaps ensure effectiveness of healthcare?
Yes, Suan, I fully agree with you. And what we are doing under that national health, I just found the document I was looking for to talk about data management. Under the National Health Information Management System policy that we are now going to be driving full steam ahead, now that we are coming off this stage of the pandemic, that is part of it. Because in managing a healthcare system or any system, data is important. So we're going to put the horse before the cart. We need to get this policy working with the Ministry of Digital Transformation in place, and that is how we are going to drive it, because then we'll have data at our fingertips. The same way we started that data drive to bring down maternal mortality, infant mortality, because we have the information. We digitize that through a program called SIPS, the Perinatal Information System. And that shows you the positive impact that data can have, so you can monitor these areas frequently. So thank you very much, Suan.
Thank you, Minister. TV6, I know you have another question, so let's go to you now, please.
Hi, yes. Minister, I made special note, and I was very happy to hear that the blackout did not compromise patient care in the public healthcare system. But I wanted to ask, did the ministry at all receive any reports from the private healthcare system as it relates to that blackout?
Short answer is no. I haven't had any reports from the private healthcare system.
Thanks, Minister. Let's go to TTT, please, for another question.
Yes, hi, good morning again, Sonalala, TDT. Minister, one of the things from the report is that the committee recommending that the C40 should be continuously open 7 days per week. Can you just clarify what is the status at this point in time? What is happening now?
Yeah.
And secondly, from our sports department, in terms of I know the Under-19 World Cup would have recently been concluded. I'm not sure if Mr. Hines would like to answer, but what effect have we seen from that? I know we haven't had any basically upsurge of cases, but what was the effect from that? Has there been a downward trend of cases? Has it not impacted on the number of cases that is?
Okay, thanks. So I will try to attempt first question and pave the way for the second one. Here, so C40. So pandemic or no pandemic, C40 on weekends and public holidays has always been available because there have always been mechanisms in place to facilitate the acquisition of critical items outside of normal working hours. So those mechanisms have always been in place, even though you don't have a pandemic. If any hospital, any RHA needs critical supplies that is not available by borrowing from another RHA or another facility, C40, through our mechanisms with the principal pharmacist, has always had that accessibility for critical supplies. Yeah? So I want to give you the assurance that during the pandemic, anything that was critically needed was always available by opening C40 and getting it and sending that. The CMO will now deal with the second part of the question.
So as part of the local organizing committee for that particular event, the Ministry of Health did have a focal point on the committee that liaised with my office from time to time. The person was there really to monitor what was happening with the events in terms of if they picked up cases, if they had to quarantine, isolate any cases. And of course, there was a medical team assigned by ICC as well that was in contact with the on-the-ground Trinidad and Tobago team. I haven't received any such reports of untoward events coming out of those events when they occurred. And just to remind, I think the events occurred without spectators in the stadia at different points in time. So we haven't seen any significant impact coming out of it. I know, yeah, from that particular event, and again from our representative on the committee, they haven't conveyed to my office any particular concerns.
And just going to Dr. Hines, I believe he just has a little to add on the topic.
So the only thing I'd add is that what we're looking at is that overall data that we have been collecting, and that supports exactly what the CMO has been saying in terms of no changes in the trend with the data. So we haven't seen any reflection of anything happening in the population as a result.
Thank you, Dr. Hines. AZP News, we go back to you for another question, please.
Hi. Regarding the blackout on Wednesday, we learned from Parliament yesterday that a generator was being installed as part of the contingency plan at Mount Hope. Were there any other generators being installed throughout the public health system, and perhaps at what cost, as part of the contingency plan as well? Thank you.
Okay, thanks. So, Suan, those are questions that are very operational at the level of the CEOs. I wouldn't have costs and so on. When you are dealing with an emergency, we do what we can, but those are very operational issues that you could reach out to Mr. Davlin Thomas at the NCRHA to get details of those particulars. Thank you.
Thank you, Minister. And we go to Newsday for the first time. We'll get questions from Newsday. So Newsday, 2 questions from you, please, if you need to. Nice and brief. Thanks.
Hi, good morning. This is Rhea Chitram from Newsday. I'd just like to find out what's the process for administering other vaccines to students at schools, for example, the chickenpox, HPV vaccines, etc. And really, what role would the Ministry of Health be playing in that exercise?
So we're speaking about the press release that went out yesterday. Really spoke to the administration of COVID-19 vaccines to the 12 to 18 population with the schools. We have been in collaboration with the Ministry of Education, as the release indicated, and we'll begin that program on the 21st, which is next week, Monday. The program continues to be in place for all other vaccinations through the local health centers. There are some outreach programs that have occurred through the school health program for quite a long time now for other vaccinations, for example, yellow fever in the past, and that will continue. But this was as it was related to COVID-19 in particular. The press release spoke to that vaccine.
Thank you very much. And TV6, a follow-up question from you, please.
Okay, yes, Alicia Boucher again. I guess this one would be for the CMO. A patient at the Eric Williams Medical Sciences Complex claims that she had to pay $800 for a biopsy needle, and she was told that the hospital didn't have any. Are you aware of any shortage in the system of biopsy needles?
Yeah, so let me take that one again. We wouldn't have that information at that level, What I can do is reach out to the CEO, Davlin Thomas, and or the Chief of Staff to find out. But as we always advise you, Alicia, if you have that information, send it to the Corpcom, and we would love to work with you to find out these things. But there are 3,000 patients in the public healthcare system. So it's difficult for any one of us to know about the status of individuals. But you have raised an issue. I thank you for it, and we will certainly reach out to Mr. Davlin Thomas or the Chief of Staff to find out. Thank you.
Thank you, Minister. Just see AZP has a follow-up question. So let's just go to AZP quickly, please.
Hi, Minister, you have been saying that you wanted to reach the 50% vaccination goal, and that's a good place to be. But now that we're there, what's the next step going forward? What's the next goal, and how does the ministry intend to reach there?
Thank you. So as I've always said, 50% and where we are is a half-decent place to be. I wish we had made it sooner, because so many more people could have been alive today if they did not pay so much attention to the anti-vaxxers' messages. And the report clearly says that, which we have been saying all the time. While it's a half-decent place to be, we should have reached this by around October, November last year. And so many of those deaths which were coming to us at 30 a day, 25 a day for prolonged periods could have been avoided. So the next step is to continue the drive. We went into markets and so on yesterday, Princestown, I believe, Pinal, Tunapuna. That gave us a yield of a couple hundred. We will be continuing those public place drives every weekend, every Friday, every Saturday, to put the vaccines where people meet for transport, to go to the market, to shop, so that they don't have to come to a mass vaccination site, they don't have to come to a health center. So we hope that we continue to vaccinate about 300 to 500 persons per day out of that, and let's see how we do that. In looking at international media, and I was having this conversation with the CMO yesterday, people around the world, I don't think this only happens here, people around the world seem to be putting COVID-19 behind them. And you are seeing non-adherence to masking and all the public health measures because people just want to get back to normal. But I would like to see more and more people vaccinated. After Carnival, we are going on another vaccination drive with new messaging and so on. And we are not giving up. As many people as possible who want to get vaccinated, we are going to make the vaccines available, freely available and accessible, and give you as much information as possible to make an informed choice. Thank you very much.
Thank you very much, Minister. Let's go to Newsday, please, for a follow-up question.
Hi again. I just wanted to find out what exactly is the ministry doing about the important sales of COVID test kits being advertised by pharmacies? Really, I just wanted to know if it's being monitored and how it's being monitored. And for people who use these home test kits and those that have a positive result, what do they do? Is it that they go and report to a health facility or the Ministry of Health?
Yeah, so the monitoring again is under the Chemistry, Food and Drug Department because they have the legislation under them, and their officers have been monitoring the situation, and there have been instances where they have actually seized some of the kits which were not registered from certain areas. In terms of reporting, once you have a positive result, we recommend, especially with this new variant of concern in Trinidad and Tobago being the dominant variant, that we do have a confirmatory PCR. And we also report to our nearest health facility or private practitioner as soon as possible.
Thank you very much, CMO. And I see no other questions from the media at this point in time. But as you know, I try to remind the public every weekend about vaccination locations. And you can go right now, as I say, every weekend, So today we have vaccination at the paddock that ends at 3. In East Trinidad, you can go to Costa El Dorado, that ends at 3. The Larry Gomes Stadium is both a walk-in and a drive-through, and that ends at 3. And you can go to the UTT campus in Chaguanas, that's in central Trinidad, that ends at 3. And note as well that we also had vaccination at the Farmers Market at Queen's Park Savannah that ended at noon, and at Sapa that ended at noon. So as Minister says, we're really trying to make sure that vaccines, COVID-19 vaccines, are available, are accessible at various parts of Trinidad and Tobago. And so, ladies and gentlemen, I'm sorry, I do see a follow-up question from TV6. I think we have just enough time to squeeze in Ms. Bouchier, so let's go to TV6, please. Are we able to facilitate? Okay, thank you, Ms. Bouchier. Can you start again? We missed the beginning of your question.
Sure, no problem. I'm asking this question on behalf of concerned parents of toddlers and babies. There is apparently a recall on select lots of the Similac baby formula, in particular Alimentum and LD-Care, which were produced at a Michigan site in the United States after 4 babies became ill. Do we have Similac coming from that particular location? And if yes, would there be any efforts to recall those batches?
So the answer, yeah, thank answer. So the answer is no. We have layers with the Chemistry, Food and Drug Department, and as far as their checks have indicated, following up with the importers of this particular product, the listed country of export did not include Trinidad and Tobago at this time. If anything changes from our side, we will advise the public in possibly a press release. But for now, the Food and Drug Department has confirmed that through the importers that the listed country of export did not include Trinidad and Tobago.
Thank you very much. And just checking, do we have a follow-up from Newsday? Or that's no longer. Okay, so we've come to the end of this morning's media conference. Thank you, everyone. Remember that if we all do our part, follow the guidelines, wear the mask, wash your hands, keep your distance, and get vaccinated, then eventually together we can bring back the old-time days. Everyone, please be safe. We encourage you also to get your COVID-19 vaccine. Have a good one.
I'm Megan Ali. I'm from the San Juan area, and I'd like to encourage others to get vaccinated because in this current climate, we need to protect ourselves and our family members and to